Malaysia's food is so good. Everything is around food. Our business meeting, family gatherings, hanging out with our friends, food is just good. But did you know that 2.5 million adults in Malaysia are diabetes? We are the highest rate diabetes in Asia and top worldwide. This is what Dr. Raymond has to say.
Diabetes is it's a chronic condition. It is characterized by the state of hyperglycemia, which means high sugars. Part of it could be due to genetics, but some of it could be due to lifestyle. So sometimes if you maintain unhealthy lifestyles, that can result in someone getting diabetes. Symptoms they may get is they will have complaints of thirst, and they will have the habit of drinking lots of water, and also they will have symptoms of frequent urination, and they complain of tiredness, feeling lethargic. They feel just tired all the time. And the other symptoms are they can also get recurrent infections. Okay, generally the diabetes in the long term can result in two types of sort of complications. We're talking about what's known as macrovascular complication or microvascular complications. Macrovascular complications are generally diseases of the heart, for example, heart attacks, cerebrovascular accidents such as a stroke. So what are the microvascular complications? They are complications of the eye. So it's quite common people with diabetes end up with either visual disturbances, poor sight, and end up sometimes with blindness. They end up with numbness either in the hands. Usually it starts in the legs, but it can be hands or legs. And then you also have kidney complications. So they can end up first with just the beginning of the symptoms are like frothy urine. So you notice more protein in the urine. And then later they can end up with actually kidney damage and kidney failure. Besides doing fasting blood sugar, we also sometimes do something called HbA1c, which is an additional test which is called glycosylated hemoglobin test, HbA1c. It gives you a 3-month average sugar reading in the last 3 months. So it's a very accurate testing of how bad the sugar was previously. So based on that, if the diabetes is, for example, mild to moderate, then of course the mainstay of treatment is we would start the person on oral medications. Okay, but of course if the diabetes level based on the HbA1c levels are moderate to severe, then we at the onset or the time we see the patient, we immediately start the patient on insulin, because if the levels are too high, normally oral tablets may not be sufficient. 50% of your diet should compose of carbohydrates, 30% fats, 20% proteins. So if you consume in that proportion, I told you just now 50, 30, 20, that's a healthy proportion. But make sure the carbs are healthy carbs. Like, you know what I mean? Like I said, it is low GI carbs. So it means like, you know, basmati rice and brown rice instead of white rice, polished rice, you know. So saturated fats, usually they're found in animals and dairy products, okay? So we need to consume less of that. More of the olive oil is good. Lean chicken, lean fish. Avoiding meats like, for example, beef, mutton, which are considered red meats, a bit more unhealthy. And of course, avoiding too much of seafood, so less of that.
It is a fact that diabetes is the mother of all diseases. Therefore, we should always be cautious. Lead a healthy lifestyle. Eat healthy, exercise regularly, and seek medical advice when in need. Remember, stay healthy and stay happy.